everyone. I'm John Evans. Welcome to another episode of One-on-One. Poverty, affordable housing, healthcare, just some of the issues this community has faced for generations. And I've reported on a lot of approaches to try to address each and every one of those issues. Patrick Brien's organization, called Cape Fear Collective, is taking a different view of them, one from about 10,000 feet, where he can see potential partnerships and innovative opportunities and look long-term at what they might accomplish. Now, if you're confused, don't worry. I was too when I first started learning about Cape Fear Collective. And that's why I wanted to go right to the source, Patrick Brien, the CEO, to learn more about how it works, to learn about him too, his vision for the organization, and what he thinks it can do to benefit this place we all call home. Well, Patrick Brien, CEO of Cape Fear Collective, Army veteran, husband, and don't forget, dog owner, welcome to the One-on-One with John Evans podcast.
Thanks for having me, John. I'm happy to be here.
I appreciate you taking the time. I have always in my career, Patrick, told reporters to describe their story to me in one sentence. I'm going to ask you, can you describe Cape Fear Collective to me in one sentence?
It's a tough one, but if I had to, I would say we follow the lead of the community and we bring along data and capital. That's probably how I would couch it in one sentence.
Stuff like this, though, doesn't come about. You don't wake up in the morning and say, I'm going to start Cape Fear Collective.
Sure.
When did the genesis for this develop, Patrick?
So it was really a kind of a community conversation, probably going back to about 2018, where Live Oak Bank, Encino, and some other funders were engaging community nonprofit leaders, private sector leaders, public leaders, and kind of thinking about the post-Hurricane Florence world, what the nonprofit sector looks like today, where there was market opportunity for expansion and for gains in efficiency. And so they kind of got on this collective impact methodology train. And so really collective impact methodology is kind of like a project management platform for a broad community nonprofit sector. And so I just happened to be in the right place at the right time, started talking to some folks from the bank, and they said, hey, can you take a look into this? We're not really sure what's going to come of it. We're not really sure if there's any there, but we just know that we'd like to help, and can you tell us what you think on it? So we kind of dove in, and in the first 12 months, the team collectively took 1,500 meetings, so a lot of cups of coffee and a lot of lunches, and we just listened. We spent a lot of time listening, and that's kind of really propelled where we are today.
I must admit, and I'm not too proud to admit, that there's a lot of it that I don't quite get, and I want to use this conversation to help me and help the community maybe get a better understanding and feel for where it is that you want to take this project and what it is ultimately you want to do for the community. You wrote in a great sound off on the Wilmington Business Journal last March, and I encourage people to go there and read it because that's pretty much the most basic that I think I've heard it broken down. But you said we need to build a new system to break the old one. What is the system you're talking about?
Yeah, so I think, regardless, of where you stand politically or just kind of where you're sitting in society, right? There's always these pockets of communities and pockets of folks who kind of get left behind the kind of economic and the health trajectory of the rest of the community, right? And so when we're looking at it through really an equity lens, what we mean by equity is just making sure that everyone has access to services, has access to opportunity, is able to kind of fulfill the version of their dream and their life outlook that they want to pursue. And so, unfortunately, there are barriers to access, and folks aren't always able to dive into the work that they want to do or the education that they want to receive. And a lot of these things are policy driven. A lot of these things are just economically driven. But there are real disparities in the community, and we kind of feel like through using data and using the lived experience and talking to folks on the ground, and then mobilizing capital around the insights we derive from those conversations and those data insights, that we can kind of redefine some of those access barriers, and we can break some of them down. We can make it a little easier for just working class folks to be able to go where they want to go and get to where they want to get. And particularly in terms of marginalized communities, try to allow those communities who already have so much resiliency in the face of overwhelming odds, again, just achieve what their version is of kind of the American dream.
So do you see yourself then being at a time when funding may not be available for grants and when budgets in many times are being cut because right after Florence, let's face it, the county, the city, the state really were at a loss for some of that capital that they might put into grants. Do you see yourself being that funding arm more than anything else then?
Yeah, so I think when we dove into the community and started to listen, the two primary things that came out of that in terms of needs, there was already a lot of coalition building. Nonprofits are very excellent in this community. They are very experienced. They're doing all the right things. But the two things that we felt were gaps in the market were data and capital. And we'll see where the capital conversation goes. We've got the endowment. We have a lot of other kind of a lot more attention being paid to Southeast North Carolina from state level funders. But the data in particular is where we led with. No amount of money, no amount of organizational infrastructure can kind of properly solve some of these really complex kind of nasty problems that we're dealing with without really effective real-time useful data, digestible data that is accessible both to the nonprofit leader, but also to the elected official, to the voter, to the taxpayer, to the private sector in terms of how corporations interact with the community. So I don't necessarily think that we're there to be a funder, while our social impact investments are we're just trying to open up a new tranche of capital to access by nonprofits. But I think that most importantly, we're able to provide organizations with the data they need to say, here's the problem I'm solving and here's how I'm solving it. And then go out to other funders and say, you can count on us. We're making a difference. We just need help to scale.
One of the other things you wrote in that article, Patrick, is, but the outcome of this process cannot be transitional change, but rather generational change. We must realize that this new approach is not just a way of thinking or doing, but a new way of being, existing, or infinitely operating to further social, economic, and health transformation. So when you're talking about generational change, when will leaders say, Cape Fear Collective made a difference? I did this and this has come out of Cape Fear Collective, or that this is an offshoot of something the Cape Fear Collective really molded and made happen?
Yeah, I think to a certain degree, what we hope is that nonprofit organizations will be able to look back years down the road and say, we were able to continue the work that we were already doing. We were able to amplify and increase and scale the work we were already doing through the data and through some of these capital infrastructure investments that we were able to do by partnering with Cape Fear Collective. I think that's really where it starts. And I also think that to a certain degree, we're constantly focused on systemic change. So we're not trying to build a program to solve this finite problem. We're trying to strengthen communities and trying to think about how do we better invest in kind of staff, stuff, space, and systems. And really those things will transcend generations, because that's, no matter what the problem, whether it's COVID, a hurricane, an economic downturn, it's the systems, it's the people, it's the organizations within our broader community that are really going to be able to transcend those issues and kind of continue that generational progress forward. So I think that element too will hopefully kind of speak to that long term.
Staff, stuff, space, and systems. Interesting the way you put that, because it seems like that's, besides air and water, that really are the four successful things people need to take that next step up on the ladder, correct?
Yeah, and I think, I'm kind of stealing it from an old boss of mine named Dr. Paul Farmer, who helped found Partners in Health, which is a global health nonprofit. And I worked, in Partners in Health in Rwanda before coming here. And so we would see that a lot, especially 80s, 90s, you're looking at international development, and it would be, here's an intervention to fund antiretroviral therapy for HIV. But this is the only thing we're going to do is fund that therapy. And we'd say, well, can we take some of that money and build a health clinic? Because we need a health clinic to be able to administer this care. We need health workers. We need the cold chain. We need all the things that come along with administering that. And there was a real pushback to that. And so when you see things like the Ebola outbreak, you see earthquakes, it's not necessarily the kind of programmatic, very finite interventions that solve those issues and kind of can transcend no matter what the problem that you're trying to get at. It's the systems, it's the people, right? And so I think what we're trying to do, and I think you're seeing this funding landscape change in America as well, is that it's not so much about, this little poverty intervention, we're going to solve this little problem. It's how do I strengthen the organizations around that issue so that they can problem solve on their own. And we kind of democratize that social impact in such a way that we then really take off in terms of scale and different business plans.
But then when you're talking, and let's use that Rwanda example,
Yeah.
as you're talking about it, you build a health clinic. That is something tangible. That's brick and mortar that people can see a benefit of the process that you had. But when you're talking generational change, there's not really that much brick and mortar, though, there is it? You're talking about maybe when businesses start going into an area where downtown Wilmington has not had, let's say, a supermarket, or they're at a food desert. Mm-hmm. So you're not necessarily talking about brick and mortar. You're talking about mindset, correct? Is that, am I getting there?
Yeah, I think it's both, right? It's the mindset of saying, we're not going to just address the finite problem, but we're going to play an infinite game here and realize that, we need to invest in things that will, no matter what the problem area, will transcend kind of those issues. So let's look at COVID as a good example, right?
Okay.
If we were just going to go ahead and solve for primary care and solve for healthcare as it was prior to COVID, we might be doing, very, very specific interventions around, do we have enough primary care physicians, et cetera. But then when COVID comes, something we could have never have expected, if we had not put the investments in great healthcare and great hospitals and nurses and health clinics, they were able to distribute, testing and distribute inoculations and distribute vaccines very quickly, right? We would have never been able to kind of react to that whatsoever. And the same thing happened in Ebola in West Africa, right? It wasn't necessarily the kind of interest, the investment in the vaccine, right? But it had to be the vaccine plus the health system. That's how you got it delivered to that last mile to that individual. So I think there is a mindset shift in terms of, are we just trying to end poverty? Are we trying to build the country's best poverty reaction system, poverty support system, so that no matter what, poverty is a reality of our society, but we're measuring ourselves by how long someone is in that poverty pipeline versus how many people are in poverty. And so there's a mindset there, but there's also a way we invest. There's also a way we build. There's also a way we look at where we're putting facilities and what we're building and why we're building them. Mm-hmm. They kind of are both codependent in that conversation.
So the brick and mortar is part of it, but it may not. It's a small part of it. It's more of the being able to look back and say, person A, whereas a generation ago, the family member might have been in poverty until they were, just pick a number, 35. This person A got out of poverty at 21 and is able to build a family and a more successful lifestyle a certain amount of years after the prior generation.
Yeah, you're measuring access, right? To that person. Can that person make choices, right? Because so much of poverty is just a restriction of choices,
right?
And can they make those choices in terms of what they want, not necessarily what's necessary to put food on the table all the time. So I think there's that element. And then when you think about how to intervene in that sense, it's, a lot of times it's, what are the organizations, what are the people, what are the services that we can provide that gets that person from A to B.
You had in that same article, there are 1,100 registered nonprofits in New Hanover County. We're going to interview every single one of them to create a social impact network analysis that provides insights into resource ratios, gaps in services, and opportunities for growth. Resource ratios and stuff like that got right over my head. But sure. the one part of it is the 1,100 nonprofits. Mm-hmm. How is it going? How many have you talked to, and what are you hearing?
Yeah, so we just started the formal surveying. We're kind of closing in on the first 100. We've talked anecdotally to hundreds.
Right.
Out of that 1,100, there's probably about 600 to 700 that are active. And we are starting to really make some traction, I think, particularly around, we live in this new COVID world. So everyone's kind of wondering, all right, how do we come together and leverage the resources we do have and the organizational partnerships we do have to do a little bit more in these strange kind of resource restrictive times. So we're well on our way. We're looking to kind of complete that study sometime in the summer time frame. We had some good media coverage of it the last couple months as well. So we're excited to kind of spur on some additional survey results there. Big partnership with UNCW and the Center for Social Impacts. We're really grateful for the academic support too, because we probably wouldn't have been able to do this without them. But then, I think that you've got this endowment coming. You've got some new types of block grants and kind of economic revitalization projects. So all this information will be really helpful in terms of understanding how we can leverage everything we got to get moving in the right direction.
You say it's for a 6-county region in southeastern North Carolina. But are the problems that different when you go into rural Columbus County as urban Wilmington and New Hanover County?
Yeah, I think the problems are, poverty, access to healthcare, right? They kind of transcend county or transcend region. But I think one of the reasons we really want to focus on the nonprofit infrastructure is because the systems are different, right?
Right.
It might take me 30 minutes to drive to a clinic if I live in a rural area, or, there's a lot of rural food deserts, which is really ironic given the agricultural economies of those areas. So I think when we go there, the problems aren't different, but I certainly think that the solutions have to be different. The way that resources are deployed is different. Market economy issues are different too. So that's one of those ways that when we go into a place, we use the kind of quantitative data, but then we interview and talk to just a lot of just normal folks, normal citizens to say, does this data, does this really reflect what your lived experience is in terms of your day-to-day and the problems you're solving? And in that middle ground, we end up finding those solutions and finding the nuances between the New Hanovers versus the Columbus or the Bladen counties.
Right. One of the strategic priority areas for CFC is to drive the data collaboration and ecosystem alignment. Again, I'm going to ask you, break down ecosystem alignment here for me and how it works with the data collaboration. Is that what you were just maybe talking about, the Columbus counties versus the New Hanovers?
Yeah, so I think, there's a lot of ways to kind of mobilize lots of organizations towards the same objective and target. And I really believe for the most part, organizations self-organize. They know what problem they're trying to solve, so they're kind of driving towards that already. I think the way we think about alignment is say, hey, here's the set of data, these indicators that we've all agreed on are things that we're trying to solve for. And then if I can show organizations what data metrics they affect on a day-to-day basis, they can now adjust their strategic planning. They can adjust their operations to target that. They now understand where they fit into the broader perspective, right? So if we're trying to solve severe housing problems, there's going to be nonprofits that are building houses like Habitat for Humanity. There's going to be nonprofits that are supporting the homeless community like Good Shepherd. And there might be case management, medical type nonprofits who are just interacting a lot with housing problems because that's just who their clientele is and some of the issues they're suffering from. Those organizations all understanding how they affect that big severe housing metric, which is big and scary and kind of like, how can we ever move the needle there? When you break it down to an organizational level, you start to have this kind of self-organizing effect where people really understand how they're driving generational change. And then by tracking that data over the long term, we're all able to adjust. New things happen like COVID. We understand what that does to the system, the underlying effects and the kind of the downfalls that occur there. And so the whole system starts to kind of operate almost with one breath, right? One voice, because we're all looking at the same metrics. Those metrics are real time and they're locally relevant.
So organizations and people who may never know that they're impacting the same people are being introduced to how they're doing it. Am I correct here?
Yeah, you're spot on. Still, if you're an organization who's working, let's say in kindergarten readiness, do you necessarily know how your intervention or how your program when your kids are 4 or 5 years old is affecting their 8th grade math scores or their high school graduation rates, right?
Right.
And so we have these systemic big issues, and you might be working in housing, but actually having a huge effect on education or a huge effect on health. And so how do I show you that? How do I show you the impact, the broader outcome you're having? And then when we paint that picture holistically at a big population level, now we start to see how the whole system and the cogs start to fit together. That data is kind of the keystone to starting that process and that conversation. We know it in our heads and hearts just because we work at this every day.
Right.
It's so hard to quantify, which means it's really hard to drive effectively and efficiently.
The light bulb just came on over my head. I imagine that's probably happened to you a lot in the last 18 months. You literally, and I told you earlier, I had difficulty understanding this.
Yeah.
And in that example, you kind of, again, turn the light bulb on in my head. What's that feeling like when somebody who comes to Patrick and says, I don't understand what you're doing, all of a sudden says, okay. That's got to be a tremendous feeling for you that you accomplished something.
Yeah, I think it's at first frustrating, right? Because we're trying to hone in on what we're getting at, and we live it every day, so we kind of forget we've really got to break it down, right? Because in my head, it's there. But I think it there's a good feeling around it because we wake up every morning to help nonprofits and to help citizens in New Hanover County, particularly marginalized populations and communities who've kind of been left behind. So the light bulb coming on is exciting for me, because now I get to take the next step with that person to help them on the data, to figure out how I can mobilize capital, to just really help them do what they do already and just scale the heck out of it. So it's a good feeling, but it gets me excited for what's next.
Well, if you can turn the light bulb on to somebody who's 58, then you've really accomplished something, young man. You're talking about capital, and in February, Live Oak Bank announced $2.5 million investment with Cape Fear Collective to support affordable housing solutions. And again, when I think affordable housing, I may think one thing, but it was interesting to me when I read the investment will be used to acquire 20 residences to address affordable housing in downtown Wilmington and Pender County. Downtown Wilmington, to me, has never been that place that I have looked at as an affordable housing mecca or an affordable housing option. So explain to me how that part is going to work. Yeah,
so I think first we start with a whole different level of, or different group of capital than we've ever been able to access as a nonprofit, right? These are investments. These are kind of debt and equity investments we're taking from private tranches. So it's not donations, it's a real life investment.
Right.
And then we're saying, okay, what are some of the kind of private market tools where we can quickly and effectively react to the broader housing market and look for opportunity to grab up what is currently affordable and maintain it as safe and affordable housing in the long term. So there is a lot of housing in town that is affordable. The issue we have with a lot of folks who live downtown is they don't own, they rent. And so that's kind of issue area number one, right? Is folks are paying a lot of rent. Can we get them into affordable ownership models if that's what they want, or can we get them into continue to keep them in affordable rental models? The other kind of issue that we have is when you talk about first-time home buyers, a lot of those programs require folks to have the improvements already done to the house. Well, a lot of times if you're looking at the 130 to 150K range, that house needs improvement. And so we solve that problem by doing that rehab for them, and then just being able to offload that house into that first-time home buyers pipeline, whether that be through the realtor, whether through its Habitat for Humanity, et cetera. So there is quite a bit of affordable housing downtown. The issue is that we're losing it. And so this is a kind of a market intervention that we've kind of created here under a nonprofit umbrella to maintain it, but also to thoughtfully think about affordable housing, workforce housing. How do we ensure that we're kind of keeping the tides of gentrification at bay and doing it in a really responsible manner that it creates more safe housing? If
you want to do that work in the historic district, then you've got 5 and 6 and 7 layers of things you have to get approved and so on and so forth. So are you talking about apartment buildings? Are you talking about standing alone properties? That's what I'm just trying to get a better idea of what the process looks like in Patrick's head.
Yeah, so I think everything's on the table. I think the issue, so the first benefit that we have is that we're not, our margins are very small, right? I don't need to make a ton of money on these deals. That's not the intent. The interest rates back to the investors are very low. So we're looking across the board, single family homes, duplexes, quads, apartment buildings, anything that we can get and then maintain as affordable, we want to go after that. And yeah, there's challenges, right? We have to rehab these homes. In a lot of cases, they need a lot of work. There's a case where you have to go around permitting and zoning, all those things. But if, whereas a for-profit market actor may say, that's not something I want to handle, or I need to make such a profit off of that it then takes out of the affordable or workforce housing tranche.
Right.
It's not going to do anyone good, but we can do that. We'll put in the work to make sure that can happen, because it's really a mission-oriented focus for us. And so where we're out there looking for homes, we're looking at things that we can keep affordable regardless of the work, but we're also thinking about, hey, this house needs a lot of work, but if we put in that extra effort and we only get, break-even margins, we're going to bring up the property values of all the homes around it too, and we're going to provide safe housing for a family. And that's pretty invaluable in terms of how we're investing that money.
So will the people who get this, will they buy it? Will they rent it? Do they pay rent to Cape Fear Collective? Do you then, the people at Live Oak Bank, what are they looking for as far as a profit, or are they just putting this in as seed and hoping it grows into something larger on down the line?
Yeah, so in terms of the investments, we usually run between 2 and 5%, right? But the way the deals are structured, so Live Oak put in $2.5 million at 2% is what the return to the investor is going to be. We're actually going to cycle that money probably 2 or 3 times over the next 5 years. So they get 2% back on 2.5 million. We'll turn that 2.5 million into probably 5 to 7.5 million in affordable housing investments, because we'll buy, we'll sell, we'll buy again, we'll sell until the duration of the investment's up. And then, we're always trying to put other nonprofits first. So the first partners that we work with, Habitat for Humanity, Link, Good Shepherd, Community Land Trust, the goal is to help get those properties into their pipelines, but also work on the private sector side for any realtor specializing in kind of first-time home buying, low to middle income families. We can also offload properties there. And so it's a great impact for the community, great return on investment for them. It keeps, a small amount for the investor that they feel like, hey, my money's making nothing in a savings account right now where the interest rates are at or anyway. So this is a good investment in my community. I can see it, it's tangible, I can feel it. Mm-hmm. And everyone kind of is able to win from that deal. And again, a whole new tranche of money that we would have never had access to as a nonprofit without this mechanism.
When did you develop the 10,000-foot view? You're up here. You're looking at things from where did that come from?
Yeah, I think I was just really fortunate to work, all over the world prior to coming here. So I think that, having exposure to how some of the best organizations globally were doing it was super helpful. And so what I've tried to do is, from every interaction I had in Africa and the Middle East, is take a little nugget and kind of have brought that forward into this work. And so a lot of what we do are this kind of mosaic of things I've seen in rural Africa, things I've seen in Boston or New York. And we've tried to put it together in a very local Wilmington context. And so I think that's what I walked in with. And then this idea early on that, we don't necessarily need another coalition or nonprofit, but really what we need is data and money. And those are two problems I could solve with innovative solutions. And I think that's when the light bulb went on for me. And that's where that 10,000-foot view came from.
How did you decide Wilmington, North Carolina?
From
Africa, from Boston, from New York?
Yeah, so my wife got a job here with Aperture when they were still early downtown. And she said, hey, I got this opportunity. Will you want to move to Wilmington? And I was working remote before working remote was even a thing now in the COVID time, and traveling a lot. And they had an airport here. And so the first time I ever came to Wilmington, I was driving the U-Haul truck with our dog down Market Street, downtown. So,
oof, wow, that's a challenge in itself. If you could do that, then you could do anything in town.
Yeah, low tree canopy on that road as you get downtown. But I've been getting to know the city ever since. And so it's really grateful for the opportunity to live here and to be here and to work alongside some great folks.
Where'd you grow up?
Both my wife and I actually grew up in Western New York and Rochester. So upstate, kind of farm area and suburban area. And then I moved around a lot for the Army and kind of bounced around until I ended up here. I
was gonna say, what were your goals? What did Patrick as a teenager want to do? Did you have thoughts on, I want to change the world at 13 or 14?
No, I just wanted to join the military at that age, honestly.
Really?
My parents just said, you got to go to college first. So we did that and then went in the Army for a while. So I think that was kind of where I wanted to go. And then I think the real, what do I want to be when I grow up started, after the Army, right? There's this kind of interesting transition and you're like, well, now what we're going to do. And so I've been on that journey for a few years now.
You had a political science degree from the University
Yes.
of Rochester. Why political science?
I think there was probably an early draw. I think very early on, I knew that, the military, international relations was a place I wanted to spend some time and kind of thinking about political systems, right? And how that affected some of the things I knew were going to be really critical parts of my life, whether that be deployment to theaters of war or just kind of interactions with municipalities and government systems. So I was always kind of intrigued by it and just kind of went for that. Honestly, it was one of those two where I knew I was going in the Army, so it was like, well, I'm going to follow this interest maybe versus following a more lucrative major.
How did the Army change you?
Yeah,
was it what you thought it was going to be when you were 12, 13, 14?
No. I think the biggest thing the Army provided me was that I got to serve alongside probably the greatest crosscut of middle America, my generation certainly has ever seen. And so I think from an early age, I was, as a young adult, was able to see people from all different backgrounds, socioeconomic, racial backgrounds, gender backgrounds, do amazing things. And a lot of these kids were people that you would just kind of pass by on the street and never give a second thought to. And here they were, coming from the projects of Baltimore, coming out of rural Oklahoma, and they were leading men and women in combat. They were doing highly technical jobs, and I think that had a huge impact on me because I saw real value in every human being I came across after that, and really kind of embraced the natural talent that we all have. It was just always in awe and inspired by them. So I think that led me into this world of how can I be a part of that? How can I keep interacting with that type of vision? And I think it's kind of meanderingly led me here.
My father was a Navy veteran in World War II, and there were parts of his service that he never talked to me about and wouldn't speak about, especially in the Pacific. Are there times in the Army, because you say it benefited you in many ways, but are there times that you won't talk about? And I'm not going to force you to, but are there things that are part of Patrick in the Army that you just have back there and don't want to revisit?
Yeah, I mean, I think, it's an interesting one, right? So yes, there's things certainly I don't want to revisit, but also, there's been such an amazing awareness around post-traumatic stress in our community now, and this idea that you don't have to be macho, man or woman to get through that stuff. And so, not something I talk about often, certainly, but the mileage is really hard, and I think it's hard for all of us. But my wife and you talk to her a lot about these things, and try to go to her for some of that solace. But yeah, I mean, there's definitely days that are kind of always there in the back of my head, day in and day out, even now, 10 years later in some cases.
What kind of dogs do you have?
I've got a German Shepherd, and then I have a Husky German Shepherd that we got about a year ago. So
why that breed?
So the German Shepherd actually was my wife's, but is now kind of my adopted dog. I like to say she likes me best, but we're pretty active, and so we enjoy kind of going out for runs with them and trying to keep up with their energy. But I worked with a lot of German Shepherds and Malinois and stuff too in the Army, so there's some comfort and familiarity there too.
How does Patrick unwind? I get the sense that you don't take a lot of time to yourself very often, but when you want to take those two earplugs out that I see in your ears right now, and you want to just decompress, how do you unwind?
Yeah, I mean, I spend, my wife and I try to spend as much kind of quiet time together as we can, and catching up at the end of the week. Our job's crazy too, so that's tough. And my favorite thing to do is actually alpine climbing and alpine mountaineering, which I don't get to do a lot of down here, but
true.
Certainly pre-COVID, made a lot of time to go do that and spend a lot of time in the mountains. So we still get out there once in a while. We'll do the drive out to Asheville and see that, but that's kind of what I look forward to, every couple months.
When people hear Cape Fear Collective, what do you want the first thing to pop in their mind to be?
I think probably just, supportive, servant leader. I think for us, we want to lean in as much as we can, but we can't do it alone. And we really believe that the individual closest to the pain, the nonprofit closest to the pain, should be closest to the problem. And we want to kind of support them in that process. So, I hope that they'll think about us as a friend, as someone who accompanied them on a journey and didn't try to talk too much, but tried to listen a little bit more.
Well, I appreciate you taking the time. I know when we set this up, I wanted it to be, as I told Kevin Maurer, who works with you, who I respect greatly for his work and his talents. I told him I wanted it to be a Cape Fear Collective for dummies. But as I told you earlier, I have learned something today about what your organization is trying to do. And I thank you for that. But I appreciate the time you've taken today to really talk to somebody and explain what it is you're trying to do in this community.
I appreciate your interest, John, and I hope it provided some clarity. But we're early in this journey too, so as you're kind of out and about seeing things, we love feedback. So we hope we can connect soon.
A big thank you to Patrick Brien, the CEO of Cape Fear Collective, for taking time out of his busy schedule and shedding some light on what he thinks the organization can do. If you'd like to learn more, go to capefearcollective.org. You can also follow the organization on Facebook, Twitter, and Instagram too. Now, before we go, I'd like to ask you a favor. Please download and subscribe to the One-on-One with John Evans podcast on whatever app you use to listen to your favorite shows. And if you would be so kind, please leave us a rating or a review. The more feedback we have from friends like you, the higher we'll be listed on the apps and the better chance we'll have of bringing in even more new listeners. I'm John Evans. Thanks so much for joining us for this week's episode of One-on-One.